Hi, welcome to the Albert Stem Cell Transplant Unit. This 30-bed unit at the Pretoria East Netcare Hospital has recently been opened and is a highly specialized unit for bone marrow transplantation and care of neutropenic patients. We opened in July this year, having completed an extensive process of design and evaluation for infection care. We have a number of features that are specific for patient protection, because whilst patients are getting chemotherapy and bone marrow transplantation, they have very high risk for infections, predominantly due to low white cell counts, but also due to extensive antibiotic use, invasive procedures, central lines, catheterization, and immunosuppressive drugs. The visitors and staff have to change when they come into the unit and wash their hands up to the elbows. The hands must not have any jewelry or watches on them, bracelets or sleeves. The people change into surgical scrubs or wear an overgown to prevent the risk of bringing in infections from outside, particularly from other parts of the hospital or wards. Once they enter into the unit, the entire unit is isolated and protected from the rest of the hospital with its own independent air conditioning unit. The air conditioning unit is a primary component of the infection control in this unit, together with the isolation rooms. There are 3 air conditioning areas, each with its own independent backup unit, and all the air coming into the unit is high efficiency particle filtered and is, in other words, very clean air, with a reduction in the risk of particularly fungal infections, which neutropenic and bone marrow transplant patients are vulnerable to. In each room, the air is under positive pressure, with an anteroom which is at lower pressure and a corridor which is at the lowest pressure, so that the airflow of clean air from inside to outside, again reducing the risk of airborne infections to the patient. The anteroom is another area of barrier to infection, with staff and visitors having to wash their hands before entering or leaving the patient's room. We have a team of dedicated and highly trained nurses who look after the patients and who have an extensive experience in the management of bone marrow transplantation, immunosuppression, and high-dose chemotherapy. Other members of the team are nurse coordinators of both the transplant and of the patients in care, dietitians, physiotherapists, nurses, and other allied health professionals such as psychologists and psychiatrists and social workers. The ward is divided, with the first 12 beds being intensive care equipped and the next 18 beds being high care equipped. Every room has an outside window looking out either onto the courtyard or into the grounds of the hospital. We operate as a multidisciplinary team with clinical hematologists in charge of the patient care and primarily responsible, but we also have a team of other doctors who take care of the patients on a day-to-day basis, and consultants for infectious diseases, intensive care, respiratory, nephrology, surgery, orthopedics, etc. The objective is to keep the patient in the unit during the entire stay. We are very privileged to be able to offer state-of-the-art care to our patients at a standard that matches the best units in the world, and with results that are comparable for equivalent diseases and types of transplant and care. We have recently completed the infrastructure development for apheresis, in other words, the harvesting of the stem cells, cryopreservation, the freezing of the stem cells, counting with flow cytometry for the measurement of the stem cells, and storage tanks in a separate secure area for keeping of the stem cells whilst the patient is receiving chemotherapy, their stem cells can be stored, or if there are excess cells to be stored until needed later. We've got highly qualified laboratory technicians and medical scientists, laboratory technologists and medical scientists to run this aspect of the patient's care and the harvesting and freezing of the stem cells. The apheresis nurses are likewise highly trained and experienced in harvesting stem cells, doing plasma exchanges and therapeutic apheresis. And again, we have a team of people that can manage this with 2 instruments so that we can do a number of procedures per day. We have 24-hour a day, 365 days a year, emergency care and backup, which extends to these allied professionals. Each room is sealed, and even the access to the air conditioning ducts and lighting units is from the ceiling to change globes, etc., so that no dust can come into the room after the patient has entered. We also do regular particle counts in the isolation facility, in the stem cell preparation lab, and throughout the unit to make sure that there are very high standards of air control maintained throughout the transplant procedure. Unfortunately, we do have to restrict access of visitors. We understand that you want to be with your loved one and to care for them, but due to the high intensity of the treatment and the amount of treatment that needs to be administered by the nurses, it's very difficult to do this if there are a lot of visitors. And in addition, the number of visitors is directly related to the risk of infection. As such, we restrict visitors to close family members only and to a maximum of 6 different people. These people can visit in shifts of 2 at a time and no more than 4 different people on any single day. Visiting hours are between 3 and 4 in the afternoon, between 7 and 8 at night. Unless specifically arranged with the sister in charge, there will be no flexibility in this visiting arrangement. We have invested a significant amount of effort and time, as well as financial resources, into establishing this unit. We are committed to excellent healthcare, as well as to being available and accessible to you and your family. I'm sure that your experience of the unit will be in keeping with these objectives, and your results will reflect that.